I read a study yesterday that examined 759 women in perimenopause and menopause. Overall, about 25% of those women reported having distressing heart palpitations. Well, somewhere between 30 and 47% of women report palpitations around menopause. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those resources are about hormones and hormone optimization. In this video, we're going to get to the heart of the matter. What's going on with heart palpitations in perimenopause and menopause? Are palpitations something to be concerned about? What can you actually do about those disturbing and dramatic changes in your heart that come on very suddenly? The definition of a palpitation is a little bit hard to pin down. Women have described these sorts of symptoms: a sudden fluttering in your heart, a feeling that your heart has skipped a beat, something in your chest that momentarily kind of takes your breath away, a loud racing or skipping heartbeats that may even resonate in your ears, something that feels like a flip-flop in your heart, a pounding that occurs with or without dizziness or lightheadedness, sometimes heart racing or just a rapid heart rate. While this symptom isn't really at the top of most women's complaints in menopause, it is something that causes a lot of women some deep concern about their own hearts and their overall health. Palpitations are often associated with hot flashes, anxiety, and panic attacks. A woman named Kim, who responded to one of my surveys, said the constant hot flashes were a problem for her, lasting 20 minutes to half an hour with heart racing and then chills. Roberta talked about a panic attack along with heart palpitations. A woman I'll call T talks about feeling like I was having a heart attack. Susie said, I feel anxious all the time and my heart races. Well, palpitations are very real, and unfortunately, they're fairly common in menopause. But are they something to be concerned about? The short answer to that question is no. There isn't anything to be alarmed about. You're not going to die from a heart flutter or a rapid heartbeat that comes once in a while. Heart palpitations in any of these forms are pretty common, and as I've mentioned, they're fairly normal for women around the menopause transition. But, and this is a big but, if you start having lots of those heart palpitations, and I'm talking about every single day or multiple times a day, that's when things might be a little bit more concerning. So it's kind of a matter of degree. If these heart palpitations are a major concern to you, if you have any sort of history with heart disease or some kind of heart problem, if you have some underlying disease, especially one that involves your heart or your lungs, then you should probably get in touch with your provider and have them at least check your heart out just to make sure everything's okay. If you don't have underlying heart or health issues, especially if your palpitations only happen once every few days or even every few weeks, calm yourself down, relax, and just keep an eye on them. There are a lot of things to worry about in menopause, but this probably isn't one of them. Well, what can you actually do about heart palpitations? Several strategies can help reduce heart palpitations. Staying hydrated, just not drinking enough water, enough fluids can trigger your heart to race or flutter. Adequate electrolytes. It's along the same line as staying hydrated. It's about magnesium, potassium, and sodium. Those are all essential minerals that a lot of us don't get enough of, and that can trigger a heart palpitation. You want to try not to drink too much alcohol and too much caffeine. Those can both trigger palpitations. Getting more exercise can help, especially cardio, which kind of pushes your heart and ultimately strengthens it. Meditation and prayer, deep breathing, yoga, all those things can help reduce your likelihood of having a racing heart or heart palpitations. I'm a big fan of spending time outdoors, especially in nature. There's a concept from Japanese culture of forest bathing. It's the idea of going out into the wilderness or into a forest or even a nature park or just a park and kind of soaking up the nature and the trees and the smells and the sky and the flowers and just allowing your heart to calm down and your spirit to calm down and your mind to calm down, those can all really calm your whole body and reduce the likelihood that you're going to have palpitations. You may even be able to stop palpitations in their tracks while they're happening. The reality, though, is that heart palpitations really only last a few seconds, if that. A fluttering heart is going to be over before you even have a chance to start some of these, but it's good to know them anyway. These strategies focus on stimulating something called the vagus nerve. That's a nerve that's specifically designed to slow down your heart rate, and it can stop palpitations while they're happening. Vagus nerve strategies include holding your breath and sort of bearing down, kind of like when you're trying to go to the bathroom and you're constipated, like putting ice or a cold, damp cloth on your face for a few seconds. Splashing water on your face, like from the sink, taking a cold shower. There are certain forms of neck massage that slow down the vagus nerve. Well, I'm the hormone pharmacist, right? What about hormones? Well, this area doesn't have a lot of scientific research behind it. There seems to be some evidence that the loss of estradiol at menopause can affect something called the AV node in the heart. It's basically an electrical communication device inside the heart that the upper chamber of the heart, called the atrium, uses to communicate with the lower chamber, called the ventricle. That's where the name AV node comes from. Well, there's some evidence that low estradiol levels that happen around menopause can interfere with those electrical signals that are sent from the AV node, and that makes heart palpitations more common around menopause. Oddly enough, though, heart palpitations are the most common in late perimenopause and early menopause. Later in menopause, those heart flutters tend to go away. It's certainly possible, though not necessarily a proven fact, that optimizing your estradiol can have an effect on reducing heart palpitations or their severity. If you're a woman in perimenopause or menopause, I'd really recommend that you talk with a hormone optimization specialist. A physician, nurse practitioner, or PA who really knows about hormones and hormone optimization and all the subtle things like palpitations is the best resource to help you navigate the complicated and difficult journey of menopause. I know some of these practitioners all over the US, Canada, and the UK. You can click the link on this video to request a referral to one of those. As you may have experienced, your primary care provider may or may not be the right person to help you with your hormones. If you found this video helpful at all, click the like and subscribe buttons. Be sure to click the little bell to get notified anytime I post a new one. Thanks so much for watching, and I'll look forward to talking to you again soon.